Hello, everyone, and welcome to today's webinar on the impacts of the COVID-19 pandemic on Black, Indigenous, and people of color artists and arts administrators. I'm Dr. Antonio C. Cuyler, the principal investigator for this study, partnering with the arts administrators of color. I'd like to start with an ancestral acknowledgement. I'd like to acknowledge that I'm a proud descendant of enslaved Africans who lived full and rich lives before their iniquitous kidnapping and enslavement on this land. I'd also like to acknowledge that I'm presenting to you today from Tallahassee, Florida, where the Appalachian Nation, the Muskogee Creek Nation, the Miccosukee Tribe, and the Seminole Tribe stewarded the land on which I now live and reside. And my colleague co-presenting with me today is Evan Linett.
Thank you, Dr. Cuyler. My name is Evan Linett. Before we begin, I'd first like to acknowledge that the land that I'm speaking from in Washington, D.C. sits on the ancestral lands of the Anacostans, also known as the Nacotchunk, and the Piscataway and Pamunkey peoples. We gratefully acknowledge that the Native people on whose ancestral homelands I'm speaking from, we occupy their homeland here and throughout the states.
Additionally, our team members included Quanice Floyd, co-founder of Arts Administrators of Color Network, Joshua Jenkins, our past president of Arts Administrators of Color Network, Gabby Shutt, and Dr. Marion Taylor Brown. We'll start with an overview today. So we'll talk about the rationale for this study, our research questions, the methodology, results for BIPOC artists, results for BIPOC arts administrators, food for thought for the creative sector, and future research. By July of 2020, the US creative sector and industries lost $150 billion in sales and 2.7 million jobs. Of 21 non-peer-reviewed and peer-reviewed studies on the COVID-19's impacts on the creative sector, only one focused on BIPOC creative therapists. Another study passingly mentioned that the pandemic has more negatively impacted BIPOC artists, specifically that they experience higher rates of unemployment, 69% versus 60%, and the expectation of losing a larger percentage of their 2020 income, 61% versus 56%. Overall, due to the enduring inequities, BIPOC communities have been disproportionately affected by COVID-19. This led us to two research questions. In what ways has COVID-19 impacted BIPOC artists and arts administrators? And number two, do differences exist in impacts in health and wellness for BIPOC artists and administrators based on demographic characteristics? We used a survey methodology. It was an anonymous 15-minute online survey. We asked participants 4 screening questions to verify that they were indeed BIPOC, that they were indeed artists, and that they were indeed arts administrators. Questions for artists and arts administrators focus on individual experiences, and we did not, in this study, include BIPOC cultural organizations. The survey was distributed via email through AAC and its cousins regime, as well as through those who applied for the Emergency Fund for Artists and Arts Administrators. We launched the survey on May 10th, 2021 and closed it on August 31st of 2021 to give respondents more time to respond. And as a result, we achieved an N of 402 artists and 160 administrators. My colleague, Evan Linett, will now talk about the regression model we used to conduct the study.
Yes, so in this study, we conducted a descriptive analysis and also an inferential analysis, which is what you see on the screen here. In this study, the ordinal regression model was used to model the relationship between the predictor variables and the outcome variables. The dependent variable in the study would be the multiple mental health outcomes that we measured by levels of anxiety, depression, despair, stress, and worrying. The independent variables that you see that make up the independent model include race, education, income, insurance, disability, status. And we see that the coefficients here, the coefficients tell you the size of the effect that each of the independent variables are going to have on your outcome variable, which is the mental health outcome. And for the error term, or the residual term, we always include an error term, which basically represents the margin of error within a model. Because in real life and in a model, independent variables are never perfect predictors of the dependent variables. Multiple regression, oh, sorry, one second, Dr. Cuyler. Multiple regression considers multiple variables in order to regress one outcome variable. So we basically regressed a number of times on each mental health outcome in order to determine which variables were most significant in the impact. And we'll get to some of these results a bit later on in the presentation. So for the independent variable model for BIPOC artists, we see the composition on the left side. For race, we see that 47% of BIPOC artists in the study were Black, 18% were multiracial, 14% of BIPOC artists were Latinx, 9% were Asian, 8% were Indigenous, and 2% were Middle Eastern. For education, this was a single select option where 20% of BIPOC artists were received the highest level of education as high school, 12% for associates, 38% received a bachelor's degree, 22% received a master's degree, 3% received a doctorate. For sexual orientation, we asked a question with a series of multiple select options with an open end. From this, we found that 48% of BIPOC artists responded that they are heterosexual, and 6% responded they're homosexual, with numerous write-in questions about another orientation. For disability status, we found that 22% of BIPOC artists responded that they have a disability, and 66% responded no. The remaining percent did not respond. For income, we found that 47% of BIPOC artists are currently in the lowest income bracket in the study of $0 to $9,500. 40% are in the second lowest income bracket of $9,526 to $38,000. 7% are in the category of $38,000 to $82,000. And then 2% are in the $82,000 category and above. For generation, we found that the most prevalent generation in the study was millennials with 60%, the second most prevalent being Generation X. For gender, we find that 43% of BIPOC artists in the study were women, and 28% were men, 9% are non-binary or third gender identifying. For health insurance, we see that about 60% of BIPOC artists have health insurance, and nearly a third, at 32%, do not have health insurance. So this is the independent model that we use to regress on each dependent variable or our outcome variable, which are measures of anxiety, depression, despair, stress, and worrying that you see on the right-hand side. Because this is a multiple regression, we can see that the independent model is used on the dependent variable. And the real intent is to look at the independent effect of each variable while adjusting out the influence of potential co-founding variables. For some more descriptive statistics about the BIPOC artist findings, we found that between March 2020 and May 2021, most BIPOC artists reported that they expected to earn between $9,000 to $38,000 at 53%, and $38,000 to $82,000, 24% of artists responded. 18% of BIPOC artists responded that they expected to receive in the $0 to $9,500. And the next lowest was 82,000 to 150,000 at 4%. And 1.25% of artists expected to receive above $1,500, $150,000 in expected earnings. We also see that 50% are currently earning between $0 and $9,000, which is a significant increase from before the pandemic, where only 18% of BIPOC artists responded that they're in that category. Additionally, artists reported that their earnings they actually are earning a little bit less even currently than they plan to in the future. And after COVID-19, most artists expect to earn between $0 and $9,000, still about 43%. And it's about the same as they're currently earning during the pandemic. So in terms of impact on performances, events, and exhibitions, numerous artists reported experiencing cancellations from events, performances, and workshops at 23%, reduced travel at about a fifth of artists, BIPOC artists. Another fifth of BIPOC artists reported cancellation of special events and increase in online presence. And it's important to note that the distribution of CARES Act funding also rolled out over the past few months. 76% of BIPOC artists applied for emergency funding through either the CARES Act or the Arts and Cultural Leaders of Color Emergency Fund. 30% of artists applied to the fund. 17% of artists applied to the Small Business Loan, and 15% of BIPOC artists applied to the Local Arts Council Fund. So there are numerous funding sources, and there's a bit of a mismatch between the actual receipt of funds, as we'll see a bit later on. So nearly 66% of BIPOC artists reported receiving emergency funding, and 50%, half, reported they didn't expect to receive funding due to the number one reason being limited funding, the second most popular reason being accessibility, the third being historic funding inequities in the arts and cultural sector. Time was also a significant right in question, or all of the above. And more than half of BIPOC artists reported that the pandemic presented them with new opportunities to create artistic and cultural experiences. Another 60% reported that the pandemic presented them with present existing opportunities that they can engage in digitally. So the majority of BIPOC artists have health insurance through their own purchasing at 43%, and their employer is much lower at about 12%. However, almost a third of BIPOC artists reported that they do not have health insurance. 80% currently say that they have received at least the first dose of the COVID-19 vaccination, and 3/4, at 75%, reported that they know someone who had tested positive for COVID-19. BIPOC artists reported that they strongly agreed that their anxiety increased due to the possibility of contracting COVID-19, knowing someone who had contracted COVID-19, increased isolation, or financial concerns due to COVID-19, and the disproportionate impact that COVID-19 has had on BIPOC communities. And we see similar trends in the measures of despair, stress, and worrying. Similar questions were asked, but we do see significant impacts in some of these areas when we conduct an inferential analysis. It's important to note that BIPOC artists within the lowest income bracket at $9,500 and below experienced a significant increase in anxieties due to the possibility of contracting COVID-19. So what we see here is a p-value, which basically says that the level of significance at the 95% level, we're very confident that BIPOC artists with a very low income have experienced significant anxieties. And we also found a similar significant result for non-binary identifying BIPOC artists. These artists have also experienced the most significant increase in anxieties around COVID-19 due to the specific impact on the BIPOC community. Again, we see the BIPOC artists with lowest incomes experienced a significant increase in other measures, including depression, as a result of financial concerns. This p-value is at 0.025, which is lower than our 0.05 cutoff for the 95% level. And then we also see for the next lowest income bracket at 38,000 to 82,000, a similar low significance level. For BIPOC artists, the value of the income coefficient, which we're measuring, it's basically the strength of the variable, we see that the income coefficient for depression is positive at the lowest income level and negative at the highest. So basically what this says is that as income is increasing, the likelihood that the likelihood decreases of reporting depression as a result of financial concerns. So we also see that race is the strongest predictor in the model for an increase in despair as a result of the pandemic. There are other predictors, but they didn't measure quite as strongly when we conducted an analysis. And we also saw that Black artists without health insurance are significantly more likely to report that their despair has increased because they don't have health insurance. And the income coefficient here as well, the strength for Black artists is positive, which it's actually significantly positive, closest to 1, which suggests that the likelihood of experiencing feelings of despair related to COVID will increase for Black artists who do not have health insurance. And it's important to note that among the Black artists who responded to the study, over 1/4, 27%, said that they do not have health insurance. And then here we also see significant finding that BIPOC male artists without health insurance experienced the most significant increase in stress during COVID-19 because they don't have health insurance. So on a bit of a brighter note, BIPOC artists are turning to multiple coping mechanisms to unwind from the many stresses that they've experienced in COVID and in present times. 1/4 of artists are using their own artistic and creative expression, as well as exercise, reconnecting and connecting with loved ones via phone calls, text, Zoom. Many BIPOC artists are turning to meditation. 6% have been prescribed medication by a doctor, and some artists are using all of the above. So when we look at the inferential results for BIPOC artists, we see that there is significance in a number of findings on mental health measures. For anxiety, to summarize, we found that BIPOC artists at the lowest income level experienced the highest increase in anxiety, and female identifying BIPOC artists have experienced significant increase in anxiety related to the pandemic. And BIPOC artists with lower education levels have increasingly more anxiety due to knowing someone who's contracted COVID-19. For depression, we see that BIPOC artists, again, with lower incomes have experienced the most significant increase in depression as a result of financial struggles due to COVID-19. And BIPOC artists with disabilities have experienced the most significant increase in depression as a result of financial hardships due to COVID-19. Again, we see for despair that race is the most significant predictor for an increase in despair. And Black artists who do not have health insurance are significantly likely to report that their despair has increased. BIPOC male artists without health insurance are also experiencing the most increasing levels of stress during COVID-19. And for worrying, BIPOC female artists and artists with a high school education have experienced the most statistically significant increase in worrying as a result of COVID-19. So for the methodology of the inferential regression on BIPOC arts administrator sample, first we had a sample of 160 respondents for the study. And we see very similarly, the independent variables are the same that we used to conduct the model. Here we see that 47% of BIPOC arts administrators are Black, 12% are multiracial, 20% are Latinx, 10% are Asian, 2% are Indigenous, and 1% are Middle Eastern. For education, 2% of BIPOC arts administrators responded that they have a high school education level, 3% have an associate's degree, 34% have a bachelor's degree, 47% have a master's degree, and 4% have a doctorate. For sexual orientation, over half of BIPOC arts administrators responded that they are heterosexual, 11% responded they're homosexual, 14% responded they're queer, and 20% responded with another orientation. For disability status of BIPOC arts administrators, we see that 18% responded that they do have a disability and 67% responded they don't have a disability. For income, we see that 11% of arts administrators have an income currently of $0 to $9,000, 22% have $9,000 to $38,000. 44% of BIPOC arts administrators have an income of $38,000 to $80,000. 13% of arts administrators have an income of $82,000 to $150,000. And 2% of arts administrators currently have an income above $157,000. The predominant generation in the BIPOC Arts Administrator study, again, was millennials, as it was with BIPOC artists at 58%. Gen X in the BIPOC Arts Administrator study represented 29% of the sample. For gender of BIPOC Arts Administrators, 53% of BIPOC Arts Administrators are women in the study, 18% identify as men, and 4% of arts administrators identify as non-binary or third gender. 91% of BIPOC arts administrators have health insurance and 9% do not have health insurance. So again, this is the independent model that we use to predict mental health outcomes and see if the outcomes we saw in the results of BIPOC arts administrators are significantly different than we would expect. So here we see the dependent variables or the outcome variables on the right. And again, we see the multiple regression model that's used. Again, the intent is to look at the independent effect of each variable while adjusting out the influence of potential confounding variables.
In terms of descriptive results, most BIPOC arts administrators reported that before the COVID-19 pandemic between March 1st of 2020 and May 1st of 2021, that they expected to earn between $38,000 and $82,000. And you can see here, about 25% earned between $9,000 and $38,000, 14% earned between $82,000 and $157,000, and 6% earned between $0 and $9,000 after taxes. During the pandemic, they actually earned $38,000 to $82,000 mostly, and some earned between $9,000 and $38,000, 82 to 157,000, 0 to 9,000, and only 2% earned 157,000 or above after taxes. Post-pandemic, they reported expecting that their salaries will remain between 38,000 to 82,000 mostly, but also some reported that they expect their salaries after taxes to be between 9,000 and 38,000, 82,000 and 157,000, 0 to 9,000, and 2% only 157,000 or above. As a result of COVID-19, BIPOC arts administrators reported experiencing an increased online presence, reduced travel, canceled exhibitions, performances and workshops, and canceled special events. They use financial services or all of the above. Approximately 53% reported that they had applied for emergency funding, including the arts and cultural leaders of emergency funds, small business loans, other opportunities, local arts councils, National Endowment for the Arts, the State Arts Agency, State Emergency Loan, and crowdfunding. As a result of COVID-19, BIPOC arts administrators reported experiencing, again, an increased online presence, reduced travel, canceled exhibitions, performances, workshops, and canceled special events. They use financial services. 75% reported that they received funding, but only 54% expected to receive funding. For those who did not apply, they listed the following as reasons for not applying for funding: limited available funding, time, historic funding inequities and accessibilities, years of operation, or all of the above. Approximately 77% of arts administrators reported that the COVID-19 pandemic presented them with entrepreneurial opportunities to create new artistic and cultural virtual experiences. 68% reported that the pandemic presented them with entrepreneurial opportunities to present existing repurposed artistic or cultural content digitally. BIPOC arts administrators reported having access to health insurance through their employer, purchasing their own, a spouse, or a parent. Still, 9% reported that they do not have health insurance. Approximately 90% reported having received at least their first dose of the vaccine, and most reported knowing someone that tested positive for COVID-19. Most reported that they themselves had not tested positive for COVID-19. Arts administrators reported that their anxiety due to the possibility of contracting COVID-19, knowing someone who had contracted COVID-19, isolation, financial concerns, and the disproportionate impact COVID-19 has had on BIPOC communities, that their anxiety increased as a result of those things. Only 13% strongly agreed that their anxiety increased as a result of not having health insurance, which makes sense given that 9% reported not having health insurance. Equal numbers agreed and disagreed that their depression increased due to the possibility of contracting COVID-19. BIPOC arts administrators also mostly agreed that their depression increased due to knowing someone who had contracted COVID-19. Yet most agreed that their depression increased due to isolation. Most disagreed that their depression increased due to financial concerns due to COVID-19. Overwhelmingly, most strongly agreed that their depression increased due to the disproportionate impact COVID-19 has had on BIPOC communities. When it comes to despair, arts administrators reported increases due primarily to the disproportionate impact COVID-19 has had on BIPOC communities. Regarding stress level, BIPOC arts administrators reported increases in stress level due to the possibility of contracted COVID-19, knowing someone who has contracted COVID-19, isolation, financial concerns due to the COVID-19 pandemic, and the disproportionate impact COVID-19 has had on BIPOC communities. Arts administrators reported similar results to anxiety, depression, despair, and stress level when it comes to worrying. More strongly agreed than disagreed or strongly disagreed that their worrying increased due to the possibility of contracting COVID-19, knowing someone who had contracted COVID-19, isolation, financial concerns due to COVID-19, and the disproportionate impact COVID-19 has had on BIPOC communities. For BIPOC arts administrators, race remains the most significant variable for predicting increased stress as a result of COVID-19. In particular, Black arts administrators and Indigenous arts administrators have experienced a significant increase in stress levels due to the disproportionate impact COVID-19 has had on BIPOC communities. BIPOC artists and BIPOC arts administrators with a high school education are most likely to have experienced an increase in worrying related to COVID-19. In particular, BIPOC artists with a high school education have experienced an increase in worrying due to the possibility of contracting COVID-19 and have also experienced an increase in worrying as a result of financial concerns due to COVID-19. BIPOC arts administrators with a high school education have experienced a significant increase in worrying as a result of financial concerns due to the COVID-19 pandemic, and 63% of BIPOC artists and 33% of BIPOC arts administrators with the high school education reported an income of $9,000 or less. Regarding self-care, arts administrators reported using connecting with loved ones, exercise, their artistic and creative expression, meditation, and medication prescribed by a doctor, or all of the above to cope with their anxiety, depression, despair, stress, and worrying.
In order to observe significant findings, we ran parameter estimates on each outcome for the BIPOC arts administrator study. So here, the significance value for the parameter has to be less than 0.05, which is the p-value, in order to be interpreted as statistically significant. Please note for this that for the BIPOC arts administrator study, the sample was 160 respondents, which is less respondents than in the BIPOC artist study, which is why here we see that depression and worrying measures showed no statistically significant predictors, partially due to the n size. For measures of anxiety, BIPOC arts administrators with a disability and without health insurance have experienced the most significant increase in anxieties during COVID-19 because they don't have health insurance. For measures of despair, BIPOC arts administrators without health insurance have experienced the most significant increase in despair due to the possibility of contracting COVID-19. And Black arts administrators and Indigenous arts administrators have experienced a significant increase in stress levels due to the disproportionate impact that COVID-19 has on Black, Indigenous, and people of color communities.
So what does this all mean? The majority of artists reported that they expected to earn between $9,526 and $38,000 and $38,700 after taxes between March 1st through May 1st of 2021 before the pandemic. Arts administrators expected to earn between $38,701 and $82,500 after taxes between March 1st and May 1st of 2021. We wonder how artists and arts administrators' income expectations compare to and differ from their non-BIPOC colleagues. With this information, we could assess the extent to which artists and arts administrators of color experience pay parity for their employment in the creative sector. Such comparisons might reveal pay inequities that the creative sector should rectify across the board because of their detrimental impacts on racially marginalized artists and administrators, but also the sector at large. For example, a recent Citigroup study found that the US economy lost $16 trillion as a result of enduring anti-Black racism. We wonder how much money the US creative economy has lost due to the enduring racism in the sector against BIPOC. Second, nearly 76% of BIPOC artists reported applying for emergency funding through the CARES Act or other opportunities, and almost 66% reported receiving emergency funding. However, 50% reported that they did not expect to receive funding due to limited funding available, accessibility, historic funding inequities, time, years of operation, or all of the above. Conversely, 53% of BIPOC arts administrators reported that they had applied for emergency funding, and 75% reported that they received funding. However, only 54% expected to receive funding due to similar reasons listed above. Having access to this knowledge is critical for fostering a better understanding of the ways in which BIPOC artists and arts administrators experience inequity within the creative sector and the impacts these inequities continues to have on their lives.
Any time is a bad time to live without health insurance, but a global pandemic is an exceedingly bad time for one to live without health insurance. Yet a third of BIPOC artists and 9% of arts administrators reported that they do not have health insurance. The fact that some arts unions dropped artists' health insurance because they did not get enough work to qualify to keep their health insurance is deeply troubling as well. Furthermore, because of enduring discrimination in the performing arts, race may have made BIPOC artists more vulnerable than their white colleagues for loss of their health insurance. This research could inform advocacy and policymaking that would provide healthcare for BIPOC artists and arts administrators. In terms of health and wellness, BIPOC artists and arts administrators overwhelmingly strongly agreed that their anxiety, depression, despair, stress, and worrying levels increased due to the possibility of contracting COVID-19. Knowing someone who had contracted COVID-19, isolation, financial concerns, and the disproportionate impact that COVID-19 has had on BIPOC communities. We argue from the results of the study that all future advocacy agendas in the creative sector at the local, state, and federal levels should make addressing intersecting economic, environmental, health, and racial inequity a top priority. The creative sector might accomplish this by developing explicit anti-racist cultural policies informed by transformative justice. Even when subverted and undermined by white appeasement, the landmark civil rights legislation of the 1960s serves as perhaps the most instructive model for the creative sector. Civil rights legislation has proven the most successful policies for improving racially marginalized communities.
So for future research, we propose 4 research questions that researchers could explore based on what we found in the study. First, how do BIPOC artists and arts administrators' income expectations compare to and differ from their non-BIPOC colleagues? A quantitative study of this topic would help us to assess the extent to which artists and arts administrators are compensated equitably in the creative sector. We're also curious to know what amount of financial capital has the US creative economy lost due to the enduring racism against BIPOC artists and arts administrators. This information might be used to compel the creative sector, which typically is always looking for additional funding, to discontinue racist practices that have undermined the careers of BIPOC artists and arts administrators. We also wonder, why do 32% of BIPOC artists and 9% of arts administrators lack health insurance? In addition, what barriers and challenges do BIPOC artists and arts administrators experiencing experience when pursuing health insurance, and what role do arts unions play in this process? Thank you for joining us today, and please support Arts Administrators of Color Network.